what I will say is when I've sat here and listened to everyone here, I think of how I stood on the shoulders of so many of these presidents in becoming president. And we've had and one of the things I was thinking about when we went to our House of Delegates, we have an organization that our past presidents stay active. I've been in organizations where you can't find the past presidents after they leave. I mean, it's just kind of like they don't participate, they don't help, they don't do anything. This organization, the past presidents are still around, they're still active, and they are very interested in what goes on. And you have them there, and this is something I think I could say for anyone who wants to become a president or become a leader. You've got people behind you, next to you, in front of you. They're there for you, and they help you. And I think that's something that's very important. And when I became president, I had my 2-year term was the only year we had a deficit budget. I looked at the records.
We were pretty close.
We were getting closer, but that was part of when I came on. Our membership was dwindling, and there were only 2 years from 1989 till when I came on that we hadn't dwindled in membership. So we were still looking at our organization. We were looking at what to do. So definitely number 9 was one of our big ones. But the other thing that happened was right at the end, right before I became president, the Institute of Medicine had just released their study of keeping patients safe, transforming the work environment of nurses. And we were busy doing advocacy, even though we were worried about whether we were going to stay viable and what to do. And one of the first things we did, we sent out a survey asking people what they wanted. And I heard yesterday at a meeting I was at that the group I was at was a well-kept secret. Well, I think ISNA was a well-kept secret. People didn't seem to know we existed. And I know when I would look at what I wrote and some of the things there, one of the things we were doing was telling people what ISNA was doing, where we were at, how many people were from ISNA that were on boards, that were active on different things. They were not just the legislation, but they've always had people out there promoting the practice of nursing. And at that time period, we had lots of smaller groups of nurses, and you won't believe this, but sometimes nurses told someone that their practice they weren't really a nurse. But they were hearing it, and there was a lot of division. And one of the things we were all trying to do was bring this idea that, you know what, there's lots of nurses out there, and if we'd ever really truly unite, like they did for Brenda, we are the largest healthcare working force in this state and in any area. We are the largest group. If we can unite, we're a force that can't be denied. And that's what we have to remember. And the one thing that unites us, no matter where we work or what we do, is we're there for our client. And that client may not be a hospital patient. It may be our legislator who's advocating for us there. There are different things we can do, but that doesn't make you any less a nurse. There's a feeling that you are a nurse, and we use the nursing process, and I read an article about that. That's what we basically did with the survey. We used the nursing process, but we do that. As a nurse, you do it in everything you do. It becomes part of you, and you kind of assess what's going on, you figure out what the problem is, and you figure out what to do. We became unpopular because we did away with that region system that had just been determined at the end, before Sandy came on, with Bev's group, where we went to the regions. Well, we decided it wasn't working. We couldn't find leadership. They couldn't find people there. And we went to chapters, which are still working. and some of them are working very well. Wasn't necessarily the most popular decision, but it worked. But the biggest accomplishment is we brought back the nursing assistants peer review group. And it was funded, which was really nice. And Ernie was very instrumental in that. Our legislative group was very active, but we did a lot of things, and we looked at ways to bring people together. And as Sandy said, and all of us, we look forward to this time. We're friends. And we know we may have our differences. That doesn't mean we always agree. But we're friends, and we like to see each other, and I think that was one of the things. And it's nice to see how we've changed and how it's still building. And we're working together, and I've always been proud of the fact that I'm a member of the State Nurses Association. And I don't think when I became a member I ever thought I would have been standing here as a past president. I never envisioned that. But we use lots of different ways.